like midlife, women in midlife, perimenopause, you have to start thinking differently as you start to age. It can still be an aesthetic side of things, but you have to really, really start thinking about everything inside.
Yeah.
And that might mean that you have to change the way that you train. That might mean that you have to change a bit of your eating. That might mean that you have to be a bit more committed to taking your vitamin D every day. All of those different things. Yeah. Right? So
especially in women, because hormonal balance, as we spoke, has a major impact on your bone process, right? So
welcome to Breast Intentions, the podcast where we take off the bra of expectations and dive into honest, empowering conversations. We're your hosts, Nadine and Cynthia, two Canadian girls who swapped snow boots for flip-flops in the Cayman Islands. This is your space to feel seen, supported, and a little less alone. So grab a cup of coffee or a glass of champagne and get ready for your weekly handful of truth, wellness, and empowerment. Welcome back to Breast Intentions. This is one of those conversations that could completely change how you think about your health. Today, we're talking about the Echolight, a non-invasive, radiation-free way to assess bone density, quality, and even fracture risk. And we're joined by Gonzalo from Novo Clinic, who's helping to bring this innovation to the Cayman Islands.
So on today's episode, we have Gonzalo, who is a registered nurse from the Novo Clinic down here on the island. And we have you on talking about something called the Echolight, which neither of us, were you familiar with it before? Okay. Neither of us were familiar with it, which is a bone density scanner. And it's something that's new on the market. Is it something that's new on the market?
yeah, it's been around for around 10 years now.
Oh,
yeah.
Okay.
Yeah, this technology has been around for like 10 years now.
Oh.
Okay, but definitely new down here.
Yeah, it's completely new down here, yeah. I believe we are the only clinic on island that has this technology.
Okay. So the reason why we wanted you on the podcast is because bone density is very, very important for women in midlife. I think it's starting to become a lot more recognized, but I think that it just wasn't something that was talked about enough. And now it's starting to be talked about more. One of the things that I had learned from you guys as well is so many women, they could only do a bone density scan, or at least maybe in North America, they could only do a bone density scan after they were 65. Mm-hmm. But that's just way too late. So being 44 and 50 something. We actually had the opportunity to try the Echolight. So why don't you give our listeners a little bit of info on the Echolight?
Sure. So basically the Echolight is a bone test, like you said. It works with ultrasound waves. So the way it works is like people are familiar with ultrasound already technology. They use it in pregnancy scans, for example. But this one is targeted for the bones. So basically, very simple methods how it works. You scan the person's spine and you scan their hips, just like other scans. The way the machine works is that the ultrasound waves pass the bone and come back to the machine. So what the machine does is analyzes the sound waves coming back, and it analyzes your bone density. Is also quantity and quality of the bone. So we give you different indicators as well as fragility score, and analyzes those patterns and gives you a risk score.
I thought it was really interesting too, because the way that it's done is you're laying on your back on a bed, and the scan is done on your stomach from, your sternum down, and then it's also done on your hip, and you don't move.
The waves go through your abdomen and they go directly to your bone. So when they reach the bone, they can sense it. The machine will sense if it's bone or not, and then it feeds back to the machine.
It feeds back to you.
Feeds back to us, to the machine, so we can see it on the scan in real time where you are at the moment with the probe, and then that information gets uploaded into this. So it's just an advanced ultrasound machine that has that capacity. So the technology is called REMS. So it does that waves into the bone. So it's been FDA approved. I think is originated in Italy. NASA also uses this technology.
I thought that was neat. Did you know that?
No.
Yeah, the astronauts. They use it on, NASA uses it on.
So since 2024, that they adopted this technology to measure the bone strength and the bone health. The reason being is that it's much easier with this technology. So, for example, if we compare it to a DEXA scan, where one of the main advantages of this technology is there's no radiation involved, where a DEXA scan is a X-ray waves. So those carry radiation. So the Echolight has no radiation at all.
Are there other differences between the Echolight and traditional scans?
Yeah, so the Echolight has the capacity to diminish the artifacts that you commonly would find in the DEXA scan. So some of the artifacts would be people with generative spine. So these are calculated on a bone scan like DEXA. So DEXA will give you the estimated of your bone density, including those bone spurs. So unless they are subtracted, then they can give you a bit of a different result. So we have, for example, people with prosthesis. Metal is very dense, and those will come up on a DEXA scan.
So it might say that your bones are denser than they actually are.
That could be, or the opposite as well. So depending on how, what type of
implant or bone spur or whatever, but depending on what it is.
Depending on what you find on the DEXA, yeah. So some other things would be, I think.
Yeah. I think even for you guys, from a clinic's perspective, it's a much smaller machine.
So one of the other things is that portability. So you can do it anywhere. It's portable. The costs are significantly cheaper than a DEXA scan. Also, you can find that position is important on a DEXA scan. Position of the patient, while the Echolight position is not that much important.
Can I ask you a couple of other questions? There were ones that weren't on here, but they were ones that I had before I came, and also I think when I was there, and it's more just because I've never had a bone density scan before. And for anyone who is listening that might be interested in this scan, you don't have to worry about fasting. You don't have to worry about exercising before you come. Like, none of that matters, right? You can come in anytime, like,
correct.
Whether you've done something or not, your bones are your bones. So you can't change anything when it comes to that.
Exactly. So another thing is that with this particular technology, you can scan, for example, a pregnant woman, because you're not really thinking about radiation exposure to the fetus, right? Obviously, in the last months of pregnancy, it will be difficult to scan people, but it will be also easy to people that have, for example, structural problems. If they have a scoliosis, it will be easy to scan with this machine, while DEXA scan can give you a different results. So another interesting thing is that people with, for example, vertebral fractures, DEXA will not subtract them, and it can give a different result. So all these little things can impact on the results of the scan and who's reading it. So there is all these advantages in terms of a non-radiation scan.
Mm-hmm. Okay. One of the things that I was saying at the very beginning, with now having the availability to get your bone density done at an earlier age, why does bone density become such a critical issue during perimenopause and menopause?
So as we know, it's very common that women in perimenopause and menopause, their hormonal balance changes. So they normally fluctuate and tend to decline. For example, the estrogen levels decline. And hormones are very linked to the bone remodeling pathway. So if hormone levels declined, then you're on a higher risk of bone loss and getting osteoporosis. So a little bit of stats there is that osteoporosis is one of the major problems in the whole world. I think it's estimated about 75 million of people in the world will have osteoporosis.
Mainly women?
Yeah,
so mainly women.
Yeah.
So if you look at women, there is statistics that say that 1 in 3 or 1 to 4 women in the menopause age, they will have an osteoporotic hip fracture in their lifetime.
Wow.
So that's huge,
Yeah,
right?
it is.
And the other thing is that bone loss and weakening of the bone, osteoporosis, your bone is like a honeycomb. So your bone structure changes, and just like a honeycomb, if you think how it looks, the spaces get bigger and bigger, and bone gets thinner and thinner.
Yeah, right.
Okay, it's a good way of putting
So
it.
Yeah, it is.
if we look at all this, we know that early detection would be the moving forward scenario for treating all this.
So with women, assuming that, like, there's a lot of women that assume that bone loss only matters or only happens later on in life, but what are some early warning signs for women our age, or I don't know, maybe even before?
Yeah, before even
Yeah.
mid-30s.
What are
So-
some
What should we be
signs?
looking for?
Bone loss is silent, and osteoporosis is silent, right? So, but there are clues that we can we can find. So some of them are related to risk factors. So if you have osteoporosis in the family, your nutrition is a big is a key one as well. So your intake of minerals, your hormone balance is really important, as we've been talking about this. Also, people that have frequent injuries, for example, people that had fractures that are not explainable. So there's a lot of common things that can be appointed as clues, but the trick is to catch it early. So I would think that we should take a preventative approach rather than a reactive approach, and see what we can identify. And so lifestyle can change. So all of this you can adapt, and you can treat. And the beauty of it is that bone, just like muscle, there is a tissue that's very reactive. So whatever you implement, you will see differences.
Even when we get to the honeycomb stage, like if we are at the honeycomb stage,
So
we can
bone
change
bone is completely reactive to change.
Okay.
So with for example, if you do an Echolight, you can also repeat it more often because there's no radiation. It's easy to do it. The scan takes around 15 minutes, so you can really do a follow-up scan.
How often would you say for
So
someone to do it?
that's a tricky one. So I think often will be in terms of your risk factors, your age, your GP advice in that sense. Majority, the early stages are more controllable, and you can implement changes, and you can see and track those changes, either with the Echolight or DEXA scan.
right?
So it all depends on, because there's so many factors that are involved on your bone health that is difficult to isolate things. But we know for a fact that every woman that ages will go through down this process. So we know that we can change hormones nowadays. We know that we can change exercise. We know there are medication as well that will treat this. It's just a combined approach with a GP that is specialized in women's health that can treat this and implement changes. Because sometimes people have, there's a lot of misconceptions, like people would think bone loss only affect women after 65, or only if I have a fracture, then I'll be requiring a scan. Right. So these qualifiers are put down for people to have a DEXA scan, and what we see is that we find this we find osteoporosis in a later time where it's more difficult to change. So it's all about prevention. And for example, every real thing. So if we think about exercise, people say, "Oh, yes, I do exercise," but what exercise do you do? Right. So the type of exercise you do impacts. So if your bone is very reactive, just as your muscle is reactive to exercise, if you strength workouts, and if you do weight bearing, weight loading exercises, those will impact your muscle and also impact your bone. So we know that if you have good muscle strength, good muscle portion, you know that you'll have an idea that your bone will be, your quality of the bone will be improved as well. So quality, and so Echolight fits in the sense of, it also, apart from the bone density that gives you the T-score, it also gives you a quality metrics of the bone. So not just how dense your bone is, but how your quality of your bone is.
That fragility?
Yeah, so it gives you a fragility score, and once you scan the bone, you can see all these parameters on the machine itself, and it gives you all these scores and combines them together.
T-score and fragility score. So fragility score is your percentage of chance of a fracture in the next 5 years. Is that what that is?
Yeah, so that's what the machine...
And it will give you that information.
Give you that information, yeah.
And then your T-score?
So your T-score is related to your age and to your bone density according to the age. So there's like a scale where you will feed, depending on your height, weight, and the information of the machine, of the waves, then we'll combine everything and give you that T-score.
The T-score, okay.
So you can have, can you have dense bones, but also a higher fragility score? Am I saying that right?
Yeah.
Or you don't know?
Yeah, I'm curious about, can you
possible?
be in the green in your T-score? What was that one? Just like normal bone, but can you have a high risk factor of a fracture?
So they hand in hand together, but you can see differences. So you can be on a green area on a scan, but your fragility score, instead of being on a higher scale, you will still be on a green zone, but instead of being on a top green, you'll be on another level of green. So because he does actually measures the quality of the bone. Again, I think that what happens is that the measurements go according to weight. So there's a lot of combination of results. So you can have different results. So because you
taking everything
bone,
into account.
bone quality and bone density, although they pair together. So what we find is that people, for example, if they have a very good spine, they potentially have a very good hip. But we know that the higher risk of fracture in old women is on the hip. So your hip, sometimes the values can be diminished than the spine. But it all depends on.
Everyone's different.
Yeah.
Everyone is different. Depends on all your risk fractures. So.
And like everything, like your height, your weight, your age, and your bones.
Yeah.
Like it's all kind of.
So if you smoke, your alcohol intake, your hormone levels, everything plays a
heavy weights
big.
you lift, all the things.
Yeah.
Okay.
But the one thing that people do need to know as well is that you can increase your bone density.
For sure.
Right. Just through lifting.
Yeah. So
nutrition.
all
Hormones.
those things, sleep.
Yeah. Right.
So every physiological thing can improve measurable outcomes, right?
Yeah.
What would you say is the earliest age that you would consider going and getting a scan?
Again, it depends on your risk factors.
If there are no risk factors, you're just kind of
You're
curious.
just like, hey.
Yeah, so if you, there will be people like that. There will be people that want to be on top of their
Like in their
health.
30s?
Yeah. So
Okay.
I can share this. Before I did strength training, I did an Echolight, and I'm going to do another one.
And how old are you?
I'm 34 years old,
Okay.
and I was borderline osteopenia. So, but all this relates to how sensitive the machines are and how sensitive results can be.
Yeah.
I think we should use this as a metric to guide you,
Right.
but not to just solely
Lean on.
lean on,
Yeah.
right?
Yeah, I agree.
So,
But like, are you glad that you did it? Because
yeah, so I'm super
Yeah.
glad that I did
and
it. Yeah.
did you, because you then can make those changes.
Yeah, you can implement the changes, you can see it, and you can frequent monitor it.
I think that it also gives people another reason, because sometimes you'll meet women who they absolutely love spin class, and they absolutely love yoga, and they absolutely love running. And then they go and get this test, and this might just give them that reason to, okay, now I actually do need to add in strength training, where it may not have been something on their radar before, and they now realize that it's something that they need to include, or it's okay
Because
maybe
they're
I do
obviously
need-
healthy, they're exercising like in that way.
Yeah.
Like they're taking care of their bodies, they're healthy, but
Yeah.
they could, it could change the way that they are viewing exercising
or eating protein as
Right,
well,
right.
like just amping it up just a little bit more. Where sometimes
Vitamin D
people-
is a big one. But we know, for example, that I was living in the UK for the past 10 years. And if you scan everyone, if you
Oh.
do blood results on everyone will be vitamin D
Well,
deficient.
You know
Right.
it is here too, right?
yeah.
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 And now the funny thing is that once you scan, when you we do blood results for our patients, we realize that people are actually vitamin D deficient. And we live on this beautiful island where you have
Lots of sun.
lots of sun. But the reality is that you need to be on the sun for like 20 minutes, and it needs to be on the right timing for the sun and for your absorption. And absorption varies from people to people. So it is something that should be on the radar of everyone.
Yeah.
So
Get that
I
checked
agree.
out.
as well
Yeah.
as their bone health.
And
For sure.
the other thing, and I don't know if you experienced this when you were in the UK, but coming from Canada, all doctors refuse to test your vitamin D in Canada. They're like, you're deficient, so just go and take a vitamin D.
They just assume everybody's deficient.
yeah, they just won't, which is terrible.
Interesting.
We're very
Yeah,
lucky
we
down
are.
here.
Yeah,
Yeah.
for sure.
How accurate and reliable is it? Is there research to talk
So
about
there's
that?
plenty of research out there. We know that has a very strong correlation, Echolight results and the DEXA scan. So it's on the margin of 90 to 95% accuracy.
That is really good. Yeah. Very reliable.
Another thing that changes would be like calcium deposits. So people that have calcium on their vascular system, that will count on the results for a DEXA scan, while on Echolight, the machine won't calculate those onto the bone density.
Right.
So,
which makes it more accurate.
Yeah, in terms of sensitivity, it can be more sensitive.
Okay. Are there common misconceptions women might have about osteoporosis and bone density testing?
People think that only if they have a fracture, then they will need their bone checks. People think that over the age of 65 only affects elder women. So there's another common misconception that they think that calcium will solve everything.
Oh, like taking a calcium pill.
Yeah. So there's, as we've been discussing, there's a lot on bone health and the bone cycle that interacts on it. So,
but if women are feeling overwhelmed by the conflicting medical advice, how can Echolight be used as a tool for informed personal decision making?
So everyone that want to know about their bone health can do the scan, right?
And the one thing that I do want to say, though, is in the end, like, whether you have access to an Echolight or a DEXA scan, there's going to be a lot of people that might not have access to an Echolight. Go and utilize any kind of bone density scanning that you can. So people that are listening that are in North America and they may not have access to it, go and get it done. I don't know if doctors are going to kind of shoo you away if you're under 65. I have a feeling that there's definitely a movement now.
I do too. Especially as more education gets out there around perimenopause and menopause, and coming prepared with questions to your doctor, and if this is one of them, which it should be, finding out what you can do. But even here, at least, I don't know, I guess, what it would be like in Canada or the US or in the UK or anywhere in the world. But here, we can just rock up and pay for it. Like, we can just go to Novo Clinic and say, I would like to have the Echolight scan, and pay for it. Yeah,
we'll still need a referral from a medical doctor, and also the results will be always analyzed with a medical doctor.
Yes.
Right. So there is that medical part that is important, but we do cover self-payers, and some insurance will cover it as well. Okay. But it all depends on the criteria for the scan.
For sure.
I think the main takeaway is that if you can scan, do it.
Yeah.
If you don't have access to the scan, you know what you can do to prevent things from declining.
Right.
So you know that there's nothing that you can do to stop your complete aging process.
Yeah. Right.
But
there's certain things that you shouldn't be doing.
But we know what we can do to improve your bone health and your musculoskeletal system. So we should focus on that and then try to monitor, right? And then scanning will be the way.
Well, I guess like the saying goes, knowledge is power.
Definitely.
Right?
That's one thing I said
for us.
To Gonzalo and Anya when I was at Novo Clinic and got it done. It's empowering, even just knowing, because in the back of my mind, I did wonder, very, very, very much wondered about my bone health, about, especially now that I am 52. Wondering, if everything I was doing was paying off, and you don't know, like, I think so probably, but then getting the scan, I felt so empowered after, and it was so simple. You just, lie down on the table, there's a scan, and it's like just, like going for an ultrasound. And the cool part about it is that you can see it on the screen. Yeah. You can see your results. You can see it's just like a baby. Your spine. First you do the spine, and there's the four
vertebrates.
Vertebrates that it reads. And they turn whatever color depending on if you're okay, it's in the green.
Yeah, for sure. So it is a very visual scan, because all the metrics are there, you can see it. And it gives you all these parameters about your even gives you a estimated biological age, which people find it quite
It's very
interesting.
yeah.
So it does, because it scans on your abdomen as well. When you're scanning the abdomen, it gives you the parameters of your muscle mass, your visceral fat, all these numbers that can, so you can know a bit more about your body and your health, right? But nothing is just, scanning is just one thing. The whole variety of things then impact the way you live, right?
Well, I know I had been wanting to do a scan for well over a year now, because like you said, it's silent. I had no idea, and I wouldn't have even been able to give you a guess as to where I was from a bone density side.
No.
So I was very, very curious to know, and it was quick, it was easy. I did it on lunch break.
Yep. Same.
It was fine. Went back to work, kind of thing.
The gel was very cold.
The gel was very cold.
The gel was cold. Yes.
So then if we go through so we can see the results on the screen, and then after you're given the results.
So the results go straight to your GP. So then your GP can analyze and implement changes if they need to, and share and discuss the results with you. Some people will have previous results, they will be comparable. If people have other methods that they did bone scan, they can also correlate into the fact.
So if you previously did, say, another scan.
So you can compare the results.
Okay, great.
So that's the major advances that you can repeat it. So the no radiation part of the scan makes it easy for you to do almost scan as much times as you want, right?
Yeah. Okay. If you could leave our listeners with one empowering takeaway about bone health and this technology, what would it be?
Right.
Get scanned.
Just
do it. Know more about your body.
Yes.
Right. And act before things happen.
Yeah.
It's not after a fracture that you will be thinking about your bone health.
Definitely.
It's not, people get so obsessed with different things of the body, but they don't see it as a whole.
Yeah.
And so just thinking about nutrition is not enough. Just thinking about exercise is not enough.
Yeah.
So just gather the whole picture, and if you can prevent one of the most common disease in the world, bone world, which is osteoporosis, why not start now, right?
Yeah.
Well, I think there's so much to be, because of the age, like midlife, women in midlife, perimenopause, menopause, you have to start thinking differently.
Yeah.
As you start to age, it can still be an aesthetic side of things, but you have to really, really start thinking about everything inside.
Yeah.
And that might mean that you have to change the way that you train. That might mean that you have to change a bit of your eating. That might mean that you have to be a bit more committed to taking your vitamin D every day. All of those different things, right? So, especially
in women, because hormonal balance, as we spoke, has a major impact on your bone process, right? So, you can. Science is so advanced now that you can focus on everything. So,
do you think that sometimes it's too much? Like people get a bit too
over?
No, definitely, yeah. Definitely.
Yeah. I guess you can't really, and that's kind of the question that I was asking about the scan is like, you wouldn't want to go and do it every month. Like you're not going to see something change like that. Maybe a couple times a year or something is when you're actually going to start to see
the changes that you've made. Maybe making a change on the scan.
Yeah. It's not something that's going to come as a quick fix.
No, there's no quick fixes on anything, right? So when people think that I'll take a calcium pill and that's it, there's no quick fixes, right? But we know that consistency is key in a lot of these things. So it's not one time that you don't do this, or so consistency is probably one of the most important parts.
Probably it's also one of the hardest things for a lot of people too.
It is. Routine, consistency. Yeah.
Well, how can people find you guys?
Yeah, we have our website, novoclinic.ky. They can phone us for appointment. They can show up. We are in Bridgegate House on the ground floor in Eastern Avenue. There's a lot of GPs on Ireland that know us already, so there's a lot of people. We have Women's Health there with Dr. Mike Smith. So everything can be organized.
A one-stop shop with you guys too.
Yeah, so we do a lot. So we do a lot of orthopedic pathway, but we also do the women's health pathway. So on the orthopedic side of things, we have a group of specialists a visit from the UK, and that's where my clinical role is to operate with them and to follow the orthopedic patients pathway, assist them during surgeries, but look after all the perioperative phase of the patients.
And also for anyone who is listening, I actually mentioned this to my best friend after I got it done, and she's in Canada. And I was like, you got to get one of these done. And so I actually Googled in her area, and it's a larger city, and they do have the...
Yeah, this technology has been on for quite a while, but it's not many people know about this, so it's good to be out there.
It's awesome. Well, thank you for coming on.
You're welcome.
Chatting with us. Everything bone density, bone health. We really appreciate it.
Yeah.
Thank you.
Thank you so much.
Thank you.
All right.
Thanks for joining us on Breast Intentions. We hope you felt seen, supported, and maybe had a few laughs along the way. Don't forget to share, subscribe, rate, and review us. Your support keeps the conversation alive. Follow us on social media for more insights, behind-the-scenes fun, and updates on future episodes. Got a topic you want us to dive into? We'd love to hear from you. Remember, life's too short for bad bras, toxic relationships, and kale you don't actually like. So until next time, stay bold and keep your breast intentions exactly where they belong, front and center. Now go crush midlife, or at least today's to-do list. Cheers!